subscribe. Don't forget to like, share, hit that bell notification for updates on my content, where you will see content mainly about nursing, lifestyle, and much more. So as you guys know, I'm officially an LPN, and now I want to start making content for you guys addressing like what is the LPN, what is the RN, and just like LPN versus RN, because I've been in this journey for so long that I feel like making these informational videos would help you guys a lot, because I honestly didn't really have the luck to have a lot of this information thrown out to me. I had to just do my own research, so that has really made me the strong person that I am today. So that being said, guys, this video will be about LPN versus RN. So as you know, an LPN is a licensed practical nurse, and RN is a registered nurse. So there are a lot of similarities, just because people think that they're both nurses, but their scope of practices are much different. So I addressed what those two names were and what they mean, and now we're going to address the key points of these two job descriptions. So the three key points are that RNs make roughly 35% more than LPNs. The RN education is a longer and more expensive process. Expensive and extensive. So extensive because it's like a year to 2 years more, and expensive because, of course, the longer your education is, the more it costs. Process than LPNs. And LPNs, they usually end up reporting to the RN. So that being said, guys, the main differences, we know that they have two different scope of practices, because so the LPN, basically we're going to have a certificate once you graduate school. You're going to hold a certificate, but the RN will hold a license and an associate's degree, so that's different. As an LPN now, I do have a license, but it's not the same, it's different. And one of the biggest differences between the RN and LPN is the required education. Like I said, graduating with a certification versus graduating with an associate's or bachelor's if you go on to that. LPN programs are much more shorter in length. Like I said, LPNs are usually 12 months and RN is usually 2 years. And then you can go on easily and go get your bachelor's after you finish your RN. But if you want to finish your BSN straight out of like getting your high school degree and then getting your prereqs, would take usually 1 to 2 years, and then going for your bachelor's would take another 2 years, so that would be a total of 4 years for your bachelor's. So just depending the route you want to go. 4 months, but your LPN, you can get that quickly in 12 months. What is the difference in salary, LPN versus RN? So if we look at the 2019 Occupational Outlook Handbook published by the U.S. Bureau of Labor Statistics, this states that thank you, that the median salary of an RN is $73,300, while the average median salary for the LPN is $47,480. So you can see there's a good difference there. There's a good, like, what, 20 to 30,000 difference. So that kind of goes back to one of the key points that says that the RN makes 35% more than the LPN. Now, what is the difference between the RN versus the LPN job duties? So let's talk about the job duties. Okay, so I'm just reading my notes again because I want to give you guys factual information, and like I said, I'm addressing my information from the Bureau of Labor and Statistics and also the registerednursing.org. I want you guys to go and do your research, read all about it, and just be informed. Okay, so I'm going to quickly run down a list, and this list I'm going to tell you guys the LPN job duties. And let's remember, guys, let's be conscious that each state varies. This is just a general overview of a nationwide database saying that these are the LPN job duties and these are the RN job duties, but you have to be conscious enough to go search on your state and see what your LPN job descriptions or duties or scope of practice is, because it could be different. This is just an overview of the whole United States. We know we have a whole bunch of states. So the LPN job duty: administering oral, rectal, and topical medication, administering intravenous medication with IV certifications in some states, monitoring IV sites, performing physical assessments, documenting physical assessments in medical records, measuring vitals, safely transferring patients into and out of the bed and chair, feeding and dressing, performing hygiene, changing or assisting with wound dressing, collecting specimens such as capillary blood, stool, and urine, inserting and caring for urinary catheters, providing ostomy care, caring for patients requiring kidney dialysis, caring for patients with ventilators and tracheostomy tubes, inserting and caring for patients with nasogastric tubes, providing feedings through nasogastric or gastrostomy tubes, monitoring patients in long-term and inpatient settings, recognizing changes requiring a call to appropriate physicians, performing emergency CPR, executing nursing care plan formulating by a registered nurse, communicating shift change report. So those were all, mom, la puerta. Those are all the LPN job duties or job descriptions that usually LPNs do. Now we're gonna move along and go to the RN ones. Okay, so these are the RN job duties. And let's remember that each state varies. So, including all LPN job duties, some additional skill sets for RN. So these are basically LPN and RN ones. So RN job duties include administering and monitoring patient medication, perform and lead an emergency response using BLS, and also ACLS, which is Advanced Cardiac Life Support, or PALS, which is Pediatric Advanced Life Support. Wound care as assessment, administer chemotherapy and anti-neoplastic agents, administer blood products, manage fistulas, which fistulas are usually something that dialysis patients have, administer medications through central lines, access implants, infusion devices, develop a plan of care, wellness for each patient, properly assess and manage all patients' population with appropriate intervention, measure vital signs as well as recognize and address abnormalities, take physicians' verbal orders, admit and discharge patients safely and appropriately, maintain accurate documentation, supervise LPNs, delegate to LPNs and CNAs per state regulation, supervise RNs and specialized nursing units, provide education for other nurses, act in facility leadership, ensure patient safety, which is the key. Ensure patient safety is usually the key for nursing, do the no harm and non-malfeasance or fissance. It's hard to say. Basically, those were the job duties for LPN versus RN, and like I said, the difference between RN versus LPN licensing and certification. So when we start off at the PN route, after completing a state-approved and program for LPN, you need to take the NCLEX PN, which that's what I took. And you must pass this to practice as a nurse or an LPN. For a registered nurse, you're required to complete a state-approved and accredited nursing program, which usually you'll go to an accredited college and stuff like that, and then you'll be able to sit for your NCLEX RN. and then you can get a certification to specialize in a certain area. So to wrap up this video, I want you guys to just understand that there are several differences in the scope of practice of an LPN versus an RN. Mainly, I think it's just assessments, it's teaching, and a lot of the more advanced skills like IVs, fistulas, and just stuff like that. There's a lot of things that we can't do as an LPN, but salary also is much more different. Just remember the key points that are like the increase in salary, education is much longer, and reporting, like we have to report to an RN. There's many other factors, guys, but I hope this video was helpful for you guys. And if you guys like this video, don't forget to like, share, and subscribe down below. Hit that bell notification for updates on my content. Just to recap, I give full credit to the author of this article. This article was published on February 10th of 2021. It was updated and verified, and the author is Amanda Bersheri-Andros, which is an RN and BSN. If you want to keep on reading all about it, go to registerednursing.org. I do not hold any credit to this document, this article. I give full credit to this author. I hope this information was helpful for you guys, and peace out. God bless. Bye.